Welcome to Nurse Practitioners Changing Practice. I'm Carol Berger, your host for today. Today, I would like to talk to you a little bit about a subject that's near and dear to my heart, and it has to do with oral health in children and primary care practice. So I'm talking to you a little bit about my DNP project and what got me interested in it, and show you some resources for implementing an oral health preventive program in your own practice. So first of all, when I took a position in rural health, I noticed one of the things when you're going to school to become a doctor of nursing practice, you need to look at your population and find out where the gap is. Where is the problem that you can bring evidence, things that work, into your practice? What can you do to make a difference in that community? And for me, as I was doing well child visits, what I noticed was that a lot of the children that were between birth and 5 years, and not really birth, but maybe from 6 months to 5 years, had a lot of decay in their mouth, especially the 2 to 3 year olds. And this actually was just an area that really stood out to me. So what I did was I contacted, and I'm in Missouri, I contacted the Missouri Department of Oral Health, and I found out that they do have an oral health program, but it's primarily utilized in schools. So the children usually don't get the benefit of it until they get into schools. And so I started working with the people on how I could institute an oral health preventive program from birth to 5 years in a rural area, utilizing some of the tools that they used. And some of those things were screening tools to assess whether they had high risk, low risk, medium risk for decay, assess their teeth, make referrals to appropriate dental providers, which I found to be quite challenging actually, and applying fluoride varnish to boost up the teeth. And I'll explain more about that later. So that's kind of what got me started. So here's just some facts for you. Early childhood cavities are the single most infectious disease in childhood. They're 5 times more prevalent than asthma. When you think about oral disease in children, you can think about they can't really identify the pain they're in. It affects how they eat. If they have teeth that are missing, it can affect how they speak. It can affect their quality of life in school, how they sleep, how they look, how their peers perceive them. And early childhood cavities means that they have one or more decayed lesions or missing cavities in any tooth in a child 71 months of age. So that would be, 5 or 6, right? It is, the more I learned about it, the more that I can tell you that cavities is more than just eating right and avoiding sugar and brushing your teeth. It has a lot of factors to it. There is actual bacteria that gets colonized in the mouth, and when that bacteria is combined with sugar, it turns into a low acid. So as a child eats, and their primary diet is milk when they're little, it has a lot of sugar in it. It pulls the minerals out of the tooth, making them softer. And these are little baby teeth. So these teeth aren't as hardened as adult teeth, and they decay very quickly. So, putting babies to bed with their bottles, lots of sugary drinks are very, very bad for children's teeth. And they break down very quickly. So now right in around when we started getting fluorinated water, we really started seeing things increase and help. And more recently, fluorinated water is not as popular as bottled water, and bottled water does not have fluoride in it. A lot of times we're giving children fluorinated water. Or we go buy the drinking water from the store and put it in their bottles and, in their little sippy cups, and that doesn't have fluoride in it. So it really should be coming from the tap, and most areas in the United States have a good amount of fluoride in the water, and they should be having that. But some areas, the fluoride in the water just doesn't taste good too. So you have to look at, or they might be drinking well water, and you need to have that tested. So research supports that the time to treat oral diseases before the cavity starts. And where does this happen? This happens in primary care when we see them. The increased risk for our preschoolers are bottle feeding. We should be teaching when we do our well-child visits about sugary drinks and getting that sugary substance off the teeth, brushing their teeth, how to do it, how to wean, avoiding the sugary Kool-Aid drinks and things like that. And then we have to have the right amount of fluoride intake for them, right? And then as they get a little bit older and their permanent teeth come in, we can actually now put sealants on them, and that will seal the tooth to keep, and that's where most of your cavities occurs, in those deep pits and fissures of those early teeth. So I'll go through that a little later too. So this is the role. You see these infants and young children for well visits. We see them at 2, 4, 6, 9, 12, 18, 24, 36. And then right before school, for sure, those are just regular well-child visits where we're going to give them their injections and things like that. We are talking about nutrition. We can easily work in an oral exam, and I'll show you how easy that is, and we can apply that fluoride varnish, which remineralizes that tooth and keeps it strong for actually a period of time. Research shows if we do this on young children 3 to 4 times a year, we will decrease cavities in them. So my project was to pilot a program in my little oral health clinic. I'm my primary care practice, and see supporting the, if I could assess the teeth and I varnished the teeth, I educated the parents of what did I find and what made a difference. The questions I was trying to answer was, would children birth to 5 years in a rural area have a low, moderate, or high risk for cavities? And if there was any kind of special risk factors in that area that would, account for that, if there was a specific ethnic group or groups that would be at higher risk with that, and if educational materials could help parents have a better experience. So I implemented the project. These were my demographics. I had a pretty even split between male and female patients. I had a total of 36 people in the time frame I was allowed to conduct my project. The race broke down as predominantly white with this pretty equal African Hispanic percentage. And then you can see that different age groups. The biggest group would be the 2-year-olds and the 4-year-olds. That was the highest numbers. This was my results for my question. Will children birth to 5 years in a rural health clinic have low, moderate, or high risk for cavities? And as you can see, high. It was a high risk for cavities in that age range. How many of the 36 had seen a dentist? Only one. So 97.2% had not seen a dentist in all of those ages, right? And the recommendation is that they see a dentist by age 1. But the reality is that there isn't enough dentists to go around as there is. And to get your child in at age 1 is difficult to begin with. But none of them but one had seen a dentist. Now, this was the results of inspecting their teeth. And as you can see, early childhood cavities was predominantly the biggest problem. That meant they had at least 2 or more areas of decay or missing teeth. Rampant decay was found in 8 of them. And we did urgent referrals on 25% of the children. Now, urgent referrals mean that we sent them next day to have teeth taken out, problems with their teeth. So that was a big finding. Was there a specific ethnic group? And we did find that race was a factor here. 9 out of 36 children needed urgent referrals, and 6 of these were African American or Hispanic, where 3 were Caucasian. So that now, whether or not that has to do with genetics, whether that has to do with diet, whether that had to do with, whatever the factors were, but that would be an area to start research on to see if there is something genetically or something, in the diet that we could change that would give them a better outcome. Oral health education took about 15 minutes. Normal exam takes 15 minutes. The total time with the parent is about 30. There really wasn't sufficient time for me to evaluate if the educational materials I gave them were effective, but I reinforced it every time they came in for any kind of visit. So here are the some things I wanted to show you. I wanted to show you some pictures because pictures say 1,000 words, right? This is what severe rampant decay looks like. This was painful rampant decay. They had pain when you touched the tooth, and they need surgical intervention. As you can see, they're going to probably remove these 4 teeth, and those 4 teeth are going to be gone for a period of, until they come back in at age 6 or 7. And so they're going to have to learn how to eat without 4 of their front teeth, and probably many of those bottom teeth too. This is what baby bottle tooth erosion looks like. Now, this is a child who's, probably between the ages of 1, maybe 6 months and 1 year of age. And they're surgically going to have to go in and remove that tooth. They're going to have to put the child under general anesthetic, and you'll have to sign off that they are medically cleared for that. And then they'll go in and they'll surgically remove these little teeth. And they won't come in again until 6 or 7. That's a long time to go without you just even think about that with yourself, not to be able to have those teeth. This is something that can happen. It's very, very deep decay. It's going to require a pulpotomy. That means that they're going to have to pretty much remove the entire root of that tooth, which is not as big of a deal as an adult root, but it's still significant. And you can see you've got decay there, decay there, decay there. And we're already missing the 4 teeth here. Okay, and so it's much easier to be preventive than it is to be restorative, right? Again, this is same thing here. Second lowers, these are going to require pulpotomies. So how can you help? Well, you have to learn about fluoride varnish, figure out how you're going to put it on, how you're going to put that into your well child visit. The American Academy of Pediatrics recommends it. The American Academy of Dentistry for Children recommends it. There's multiple agencies that I don't know any of them that don't recommend it. Okay. And fluoride varnish comes in a very pre-packaged little supply with a tooth, like a little paintbrush. And I'm going to show you how you do that. It's a knee to knee exam. So somewhere during the exam, you just have mom hold the child on their lap. You kind of pull them back into your lap so you can really look with, have her hold the flashlight, and you inspect the teeth, dry them off a little bit, and paint the varnish on, which tastes like bubble gum or caramel or anything like that. And it's very easy to do, and it protects their teeth. Now, it remineralizes it. So you can just see all the minerals being pulled out of it from the food is being put back in by the concentrated fluoride in the fluoride varnish. Why fluoride varnish? It sticks to the tooth. And we find that the child doesn't swallow much. It's better than a rinse. And they can still brush their teeth with a small amount of fluoride. There's recommendations on how much at what age, but there is like a pea size or a smear size depending on the age. And then parents should be helping children brush their teeth to age 7, and then really educating them about the water and things. Now, where can you get information about this? Smiles for Life is where you go, and I'm going to take you there to show you there. Yeah, hopefully we can get there. I'm going to have to reshare my screen. Yep. Okay. So hold on. Yep, there we go. All right. So this is a national initiative. It's called Smiles for Life. And so it's a national oral care curriculum. This is all courses, and you can look through here. They have them on child oral health. They have them on adult oral health. And you do get CEUs for them, so you're going to need them. Okay. So you click here for child oral health, and they're going to have you take a pre-test right here. And then you'll create, a login and everything. And then you will be able to go to the modules that'll show you how to assess teeth to find out what white spot lesions look like. That's the earliest sign of decay, and how to apply fluoride varnish, and then give you some, how to give you education on what you would give your patient. And then, of course, having a list of resources in your local area really, really helps. The last thing I wanted to show you is what, basically, this was my dissertation, or my project, right? And I want to make sure I'm sharing this with you. Okay, so The next thing I did was my next project was working with the Missouri Department of Health and Senior Services about doing a documentary highlighting what they've done. And we created a documentary, me and colleagues of mine, Scott Angus and Lily Keys and Carlita. They all helped put this together, and I would encourage you to watch this. I'm just going to start it in the beginning to give you a feel for it, and then you can watch it in your leisure. But this is something as an NP you should really consider. It's a simple thing that you can incorporate into your practice that really will make a difference in a child's life. So here you go.
Go like that.
I can't because I don't have teeth up here.
So that just gives you a feeling there. If you look at that little boy that we interviewed, he said he couldn't make that sound because he didn't have any teeth up there. And it's just a really touching story. The whole documentary is about 18 minutes long. I encourage you to look at it. We do have a link for it up on our YouTube channel. So you can see it. It's the #1, the very first one on our YouTube channel. We really encourage you to take a listen to that and see how you can implement that in your practice. Please like and share our YouTube videos and our podcast. And we promise we have been gone for the summer, but we are back and we will be having weekly episodes to bring to you again. We look forward to any and all feedback you can give us. Thank you for listening.